During pregnancy, vaginal pain can be a common and sometimes confusing experience for many women. One of the primary reasons for this discomfort is the significant hormonal changes occurring in the body. The rise in estrogen and progesterone affects blood flow and causes tissues to become more sensitive and swollen. This hormonal activity can make the vaginal area feel sore, tender, or even achy. Another major factor is the increased blood flow to the pelvic region, which is essential for supporting the growing baby, but can cause a feeling of fullness, heaviness, or throbbing in the vagina. As the uterus expands to accommodate the developing fetus, it puts additional pressure on nearby structures, including the vaginal canal, leading to discomfort or occasional sharp pain. This pressure can intensify as the baby grows, especially in the later trimesters. Additionally, common pregnancy issues like urinary tract infections, UTIs, or vaginal infections such as yeast or bacterial infections. Lastly, some women experience pelvic girdle or round ligament pain, which can radiate through the lower abdomen and down into the vaginal area, especially during sudden movements or while walking. Understanding these causes can help expectant mothers manage and monitor their symptoms more effectively. Vaginal pain during pregnancy can vary greatly in intensity and cause, making it important to distinguish between what is considered normal and what might signal a problem. Mild discomfort, pressure, or a stretching sensation in the vaginal area is typically normal, especially as the uterus grows and hormonal changes increase blood flow to the pelvic region. This kind of pain often feels dull or achy and may come and go, especially after physical activity or standing for long periods. These symptoms are usually harmless and a natural part of the body adjusting to pregnancy. However, certain types of vaginal pain should raise concern. Sharp, stabbing pain that is persistent or worsens over time may indicate a more serious issue, such as an infection, cervical insufficiency, or even preterm labor. If vaginal pain is accompanied by abnormal discharge, such as a foul odor, green or yellow color, or bleeding, it's essential to contact a healthcare provider immediately. Similarly, if the pain is paired with fever, chills, or burning during urination, this could suggest a urinary tract infection or another complication that requires treatment. Paying attention to the nature, timing, and accompanying symptoms of vaginal pain can help expectant mothers protect their health and their baby's well-being. Hormonal changes during pregnancy, especially the increase in estrogen and progesterone, have a significant impact on the vaginal tissues. These hormones are essential for maintaining a healthy pregnancy, but they also cause various physical changes in the body. One of the main effects is the softening and loosening of the vaginal walls and surrounding connective tissue. This change prepares the body for childbirth, allowing the vaginal canal to stretch when needed. However, this softening can also lead to increased sensitivity, making the area more prone to discomfort or pain with even minor pressure or movement. Estrogen, in particular, increases blood flow to the pelvic region, resulting in swelling and a sensation of fullness in the vagina. This heightened circulation may cause tingling, throbbing, or mild aching, especially after standing for long periods or engaging in physical activity. Progesterone contributes by relaxing the muscles and ligaments, which can lead to additional pressure and strain in the pelvic and vaginal areas. These hormonal effects are natural and necessary, but they often lead to symptoms that can be uncomfortable. Understanding how hormones influence vaginal tissues helps pregnant women recognize that many of these sensations are a normal part of their body's preparation for delivery. Natural remedies can be highly effective in easing vaginal pain during pregnancy without the need for medications, especially when the discomfort is due to normal physical or hormonal changes. One of the most soothing methods is applying a warm compress to the lower abdomen or pelvic area. The gentle heat helps relax the muscles and increase blood flow, reducing cramping and discomfort. Another popular remedy is taking a warm bath with Epsom salt, which can provide full body relaxation and specifically ease tension in the pelvic and vaginal region. Prenatal yoga and gentle stretching exercises are also beneficial for improving circulation, maintaining flexibility, and reducing pelvic pressure. These exercises help strengthen the muscles supporting the uterus and reduce strain on the vaginal area. Staying well hydrated and getting plenty of rest are essential as well, as dehydration can worsen muscle cramps and fatigue can increase overall sensitivity to pain. Elevating the legs when resting can also reduce pressure in the pelvic region, offering additional relief. Wearing supportive maternity underwear can provide light compression which helps distribute weight more evenly and reduce pelvic heaviness. When used regularly and safely, these natural approaches can make a significant difference in managing vaginal discomfort and improving overall comfort during pregnancy. Pelvic floor exercises, particularly Kegel exercises, play a vital role in reducing vaginal pain during pregnancy by strengthening the muscles that support the uterus, bladder, and bowels. These muscles undergo increased pressure and strain as the pregnancy progresses, and regular Kegel exercises help enhance their strength and flexibility. By consistently engaging the pelvic floor, women can improve circulation in the pelvic region, which reduces swelling and discomfort in the vaginal area. Kegel exercises are simple to perform and involve contracting and relaxing the muscles used to stop the flow of urine. When practiced correctly, they can help reduce the feeling of heaviness or aching in the vagina by providing better support to the growing uterus. These exercises also improve muscle tone, which can help in labor and postpartum recovery. Strong pelvic muscles make it easier for the body to manage the additional weight of pregnancy, reducing the chances of issues like pelvic girdle pain or urinary incontinence. It's important to perform these exercises regularly, several times a day, for the best results. Women should ensure they are using the correct technique and avoid overexerting the muscles. Incorporating Kegels into a daily routine can significantly ease vaginal discomfort and contribute to a healthier, more comfortable pregnancy. Herbal and Ayurvedic remedies can offer gentle, natural support for managing vaginal pain during pregnancy, but they should always be used under the guidance of a qualified healthcare provider. Certain herbs have calming and anti-inflammatory properties that can help ease discomfort without the side effects of conventional medications. For instance, chamomile tea is known for its soothing effects and can help relax pelvic muscles and reduce tension when consumed moderately. Similarly, lavender oil, when diluted properly and used as a warm compress, may help relieve vaginal soreness through its mild analgesic and calming properties. Coconut oil is another popular natural remedy. It can be applied externally to reduce irritation, soothe dry or stretched skin, and create a protective barrier that helps prevent infection. Its anti-inflammatory and antibacterial properties make it especially useful during pregnancy, when the body is more sensitive to irritants. Ayurvedic approaches often include practices like warm oil massages, abhyanga, using safe oils like sesame or almond oil, which help improve circulation and relieve pelvic congestion. Certain herbal supplements are also used traditionally to tone the reproductive system, but they must be approved by a doctor to ensure they are safe for both mother and baby. Natural treatments can be a supportive part of a holistic pregnancy care routine. Maintaining proper hygiene and wearing breathable clothing are simple yet highly effective ways to reduce vaginal discomfort during pregnancy. As hormone levels rise and blood flow increases to the pelvic region, women may experience more sweating, increased vaginal discharge, and heightened skin sensitivity. These changes make the area more prone to irritation, itching, and even infections if hygiene isn't carefully maintained. Gently washing the vaginal area with lukewarm water and avoiding harsh soaps or scented products helps preserve the natural pH balance and prevents further irritation. Wearing clean cotton underwear is another important step. Cotton is a breathable fabric that allows air circulation and helps absorb moisture, reducing the risk of fungal or bacterial infections. Avoiding synthetic fabrics which trap heat and sweat is especially important during warmer months or in humid environments. Tight-fitting pants or undergarments can cause friction, limit airflow, and contribute to discomfort or chafing in an already sensitive area. Choosing loose, comfortable clothing ensures better ventilation and reduces pressure on the lower abdomen and vaginal area. Additionally, changing underwear frequently, especially when there's increased discharge, keeps the area dry and clean. These basic self-care practices play a key role in preventing pain and maintaining overall vaginal health throughout pregnancy. While mild vaginal discomfort is often a normal part of pregnancy, certain symptoms should never be ignored and require immediate medical attention. Sudden, sharp, or intense vaginal pain that doesn't subside may indicate a serious problem, such as preterm labor, cervical issues, or an infection. If the pain is accompanied by bleeding, even if it's light spotting, it could be a sign of complications like placenta previa, placental abruption, or threatened miscarriage, especially in early pregnancy. Any bleeding in the second or third trimester should be taken seriously and evaluated by a doctor immediately. Unusual vaginal discharge is another warning sign. If the discharge becomes thick, foul-smelling, green, yellow, or accompanied by itching or burning, it could be an infection such as bacterial vaginosis, yeast infection, or sexually transmitted disease. These conditions require medical treatment to protect both maternal and fetal health. Fever, chills, pain during urination, or difficulty walking due to pelvic pressure are also signs of potential infection or complications. Listening to your body and recognizing when the pain feels abnormal is crucial. Trusting your instincts and seeking prompt care can help prevent further complications and ensure a safer pregnancy. It's always better to consult your healthcare provider than to ignore warning signs. Vaginal pain during pregnancy doesn't just affect the body. It can also take a toll on a woman's emotional and mental well-being. Persistent discomfort, especially in such a sensitive and intimate area, can lead to feelings of frustration, anxiety, or sadness. Many pregnant women worry that something might be wrong with their pregnancy, even when the pain is normal. This constant concern can increase stress levels and affect sleep, concentration, and mood. Hormonal fluctuations, already common during pregnancy, can amplify emotional responses to physical discomfort. Some women may feel embarrassed or hesitant to talk about vaginal pain, which can create a sense of isolation. They might avoid physical intimacy or social situations, leading to strained relationships and a reduced sense of well-being. Support from a partner, family, or close friends is vital during this time. Open communication about how the pain is affecting daily life can help others understand and provide emotional support. Stress-relieving practices such as prenatal meditation, breathing exercises, or talking with a therapist can also help manage emotional strain. Addressing both the physical and emotional aspects of vaginal pain ensures a more balanced, compassionate approach to pregnancy, where the mother feels seen, heard, and cared for throughout her journey. Making safe lifestyle changes during pregnancy can significantly help in managing vaginal pain and improving overall comfort. One of the most effective changes is avoiding long periods of standing or walking, as this can increase pressure in the pelvic area and lead to more discomfort. Taking frequent breaks to sit or lie down with legs elevated helps reduce this pressure and promotes better blood circulation. Using pregnancy pillows while sleeping or resting also provides support to the hips and lower back, relieving strain on the pelvic muscles and vaginal area. Incorporating moderate physical activity such as walking or prenatal yoga can strengthen the body and improve flexibility, which helps reduce pelvic tension. Staying active also promotes healthy blood flow, which is essential for minimizing swelling and reducing pain. However, any exercise should be low impact and approved by a healthcare provider to ensure it's safe for both mother and baby. Wearing supportive, maternity-specific footwear and avoiding high heels helps align the posture and reduce added strain on the lower body. Simple lifestyle adjustments, like drinking plenty of water, maintaining a healthy diet, and practicing stress-reducing techniques, all contribute to hormonal balance and overall well-being. These changes create a more supportive environment for managing vaginal pain naturally during pregnancy.